Good morning, ladies and gentlemen. I'd like to extend a warm welcome to the chairman of the Jamaica Anti-Doping Commission, Jadco, Mrs. Debian Brown-Salmon, and other members of the Jamaica Anti-Doping Commission Board of Directors. The Executive Director of Jadco, Mrs. June Spence-Jarrett, members of the sporting federations and associations, athlete support personnel and athletes, representatives from the professional groups, representatives from tertiary and secondary education or secondary institutions, other distinguished guests, members of the media, and the hardworking members of staff of the Commission. Good morning and welcome. I'm Adrian Atkinson, and it is indeed a pleasure to serve in this capacity once again, being your compere for the 2025 Jadco Symposium, being held under the theme Clean Sport, Shaping Jamaica's Global Reputation. And I hope that today's forum may be and will be impactful as we continue to protect the integrity of our sport. The Minister of Culture, the Honorable Olivia Grange, is expected to be here, among other specially invited guests. And until such time, ladies and gentlemen, we'll get right into it. I'd like to invite Bishop Harold Blair Jr., who is also a member of the Jamaica Anti-Doping Commission's Board of Directors, to deliver the opening prayer at this time.
Let's pray. Heavenly Father, we thank you for this day and for all that is aimed to be achieved here as we Jamaican people, the greatest in the world, our athletes, our organizations, our people, we work towards that reputation that just does not see us as great, but sees us as reputable. I pray that the work of the Jadco today and in the years to come will continue to have us working towards cleanness in sports, but also allowing the world to see that we are great, not because of drugs, not because of illegal activity, but we are great because of hard work and determination. Today, bless this symposium, and I pray that all that are present will leave here having learned something to make us even greater. In Jesus' name, amen.
Thank you very much, Bishop Blair. And to deliver the welcome and opening remarks, please help me in extending a warm welcome to the Executive Director of Jadco, Mrs. June Spence-Jarrett.
Good morning, ladies and gentlemen. Honorable Olivia Grange, OJ, MP, Minister of Culture, Gender, Entertainment and Sport, Permanent Secretaries, Chairman of the Jamaica Anti-Doping Commission, Mrs. Debian Brown-Salmon, other members of the board, First Vice President of the Jamaica Athletics Administrative Association, JTRAs, Honorable Ian Forbes, Custos Rotularium of St. Andrew, other sporting federations and associations, athlete support personnel and athletes, representatives from the professional groups, representatives from tertiary and secondary institutions, our guest presenters, other distinguished guests, members of the media, members of staff of the Commission, ladies and gentlemen. Welcome to our 2025 Symposium, the theme being Clean Sport, Shaping Jamaica's Global Reputation. As customary, this event aims to foster collaboration, educate participants, and engage in meaningful conversation about the ongoing fight against doping in sport. Today, we will cover a wide range of relevant topics, including presentations related to the World Anti-Doping Agency, WADA, and from expert medical professionals in the field with ever-growing importance of integrity in sport. The symposium will focus on both the ethical and practical aspects of anti-doping policies and their impact on athletes, coaches, and stakeholders worldwide. We believe this symposium will provide an invaluable platform for all involved in Jamaican sport to engage in the fight against doping and to promote a legacy of clean competition. It was Jim Rohan who said, "A good objective of leadership is to help those who are doing poorly to do well, and to help those who are doing well to do even better." As a nation known for our sporting excellence, it is essential that we continue to lead by example and uphold the values of clean sport on the global stage, and Jadco proudly carries the mantle of the National Anti-Doping Agency. 2 weeks ago, I was part of a delegation along with the chairman that attended the 4th Annual Water Forum held in the Cayman Islands. This time around, as the state of clean sport in the region was addressed, Jadco's leadership was reaffirmed. I'm pleased to say that we're leading the National Anti-Doping Organization, NADO, in the Caribbean and the region. If most of you can recall, the Water President Withhold Banker in 2023 described our anti-doping system as a standard bearer in the region. We have set a very high standard in testing and education, and we must maintain and will maintain this. In a short while, I'll do a presentation on Jadco's 2024 achievements. Among them, one of our most important milestones, I'm sure you handle a little suspense, 2024, was, and I will not name our remarkable milestone until I have the presentation done. 2024 was a year of remarkable progress, marked by events that strengthened our resolve to preserve our athletes' integrity and our agency. To preserve our athletes' integrity and our agency, our stakeholders and partners and wider sporting community, we value our ongoing collaboration and support. Your trust in Jadco fuels our mission to promote a culture of clean sport. I want to thank you all for prioritizing today's event, and we want to welcome you wholeheartedly. A healthy course at the end of the presentation, and to acknowledge all the federations, associations, and professional groups and members present here. I also want to extend gratitude to our Minister Olivia Babsy-Grange, and other members of her team for their ongoing support. Permanent Secretary Mr. Denzel Thorpe and Mr. Dean Roy Bernard. We want to just say thanks to you. And to our hardworking chairman, Mrs. Debbie Ann Brown-Salmon, and also to other members of the board for their continued support. We want to especially thank Bishop Harold Blair for all that he does in encouraging us in the spiritual way. I want to especially welcome a number of persons who are present here from the associations and federations, and I usually name them and recognize. We have with us today 27 member team in this room. Badminton Association, the Jamaica Rugby Union, Jamaica Darts Association, the Jamaica Nurses Association, SDF Sports Development Foundation, J-Trace, National Powerlifting Association, and hockey. For the first time, hockey is present under the new president, Mr. Michael Blair. We want to also welcome Sports Medicine, Netball Association, Basketball Association, Cycling Association, the Jamaica Rifle Association, Jamaica Bobsleigh, University Hospital of the West Indies, University of the West Indies, Rugby League, Caribbean Maritime University, CMU, Aquatic Sports Association of Jamaica, Love 101. Our chairman, we have already said that already, our Equestrian Federation, St. George's College, West Indies Players Association, Jamaica College, University of Technology, and we want to specially welcome the Jamaica Observer and also our new phone partner, CNS. All the members of the media, we welcome you all, and we know today you will learn much from our presentations. And I especially want to welcome Dr. Dawson, who's one of our presenters, and also from JMDA, we also have our doctor presenting later on. Let me just use this opportunity to encourage you, athletes and support personnel, and other distinguished ladies and gentlemen, that as we navigate 2025, let us continue to build on the foundation we have laid, remaining steadfast in our dedication to fostering excellence and fair play in all endeavors as we shape Jamaica's global reputation. I'll conclude with a quote from Marcus Garvey, who posited, and I state, with confidence you have won before you have started. Ladies and gentlemen, thank you and enjoy your day.
There's no way you can give the executive director of Jadco that kind of applause. Listen, when you talk about hardworking, we mean hardworking. And so she deserves that big round of applause. So once again, thank you so much, Mrs. Giant, for your hard work. So you've heard from the executive director, now it's time to hear from the chair herself. Please welcome, can I say Dr. Debian? We're speaking it into being. Mrs. Debian Brown-Salmon, ladies and gentlemen, the chair of Jadco.
Good morning, everyone. A pleasant and a hearty good morning. I walked in this morning and I couldn't help but notice the beautiful green, yellow, and black. Mrs. Jarrett, you and the team, wonderful job. I know you stayed up late last night to have it all done and prepared for us this morning. It's looking good. Do we agree? Are we appreciative of the Jamaican colors presented, rightfully so, here this morning? Welcome again, everyone, and thank you all for being here. How many times have we done the formalities this morning? Like 3 times, but it's what we do, and I'm going to go through the list again. The minister is not here as yet, but I know she's on her way, and we know our minister. She's carrying several portfolios, and I see Andre, so perhaps she'll be here shortly. She's always supporting us. We can always count on her for that. So I know at some point in time, she will walk in. So forgive her if she walks in during the proceedings. So the Honorable Olivia Grange, as we know, she's on her way. Permanent secretaries who are always supporting as well, Mr. Denzel Thorpe, and we have two permanent secretaries in this ministry. Lucky the minister is to have 2 men on either of her arms wherever she goes, Mr. Thorpe and Mr. Bernard, who I think one of the 2 will be in attendance as well. My board of directors, also the Honorable Mr. Ian Forbes, CD, JP, First VP of the J3As, should be here as well. Our very able Executive Director of Jadco, Mrs. June Spence Jarrett. other sporting federations and associations that are in attendance this morning. And I believe Mrs. Jarrett mentioned some 20-something of us here this morning supporting. I appreciate your presence. It's important that you're all here because this is not just to entertain you this morning or whenever we have these events, but it's for you to take the information back to your associations. That is the hope that we have when we put on a symposium of this nature. Athlete support personnel and athletes. Where are the athletes in the room? Athletes? Any athletes in here? Just raise your hands where you are. Most important persons, I think, in this room, the athletes or Jamaican athletes. Welcome. Welcome and thank you for being here. Representatives from the professional groups, representatives from tertiary and secondary institutions, other distinguished guests, members of the media who also help us to carry the information, members of staff of the commission. A hearty good morning to you all again. I trust that 2025 is already bearing evidence of a promising trajectory for each of you. Thank you all for making this annual event a priority. This is a flagship event for the Jamaica Anti-Doping Commission, which fosters meaningful dialogue with our stakeholders, our stakeholders and partners. Jadco's commitment to our mandate is very clear. Testing, and let me say that again, testing athletes, educating and enforcing the anti-doping rules in accordance with the standards stipulated by the international governing body, the World Anti-Doping Agency, WADA. In the same way an athlete carries the weight of expectations throughout his or her career, the onus is on Jadco.
Let me extend a warm welcome to the first Vice President of the Jamaica Athletics Administrative Association, J3A. The Honorable Ian Forbes, CDJP, also serves in the capacity of Custos Rotalorum of St. Andrew. Ladies and gentlemen, building trust and integrity is vital to the role of the Jadco. Making that declaration of support is also critical to maintaining the trust and integrity. And making his endorsement, Mr. Forbes, it's your time, sir. We now welcome you to deliver your endorsement.
Thank you very much, Mr. Master of Ceremonies. This is Debbie Ann Brown, Salmon, Chairperson, Jadco, Bishop Harold Blair Jr., Board Director, are the primary focus. Empower yourself by getting all the available important information. If in doubt, ask. If you see something, say something. Remember, short-term gain often means long-term. Hey, do the right thing at all times and continue to empower yourself by seeking all the knowledge and information that Jadco continues to offer. And in closing, I'd just like to say, I fully endorse the tremendous work that Jadco continues to do. And I'm pretty certain Mrs. Florette Blackwood would also agree. They also look forward to your continued collaboration with all the stakeholders, the continued support of the government of Jamaica. Jadco, I congratulate you on a job well done. Thank you.
Honorable Ian Forbes, First Vice President of the Jamaica Athletics Administrative Association, J3A. I also like to refer to him as the Custos Rotalorum of St. Andrew, because where respect and title is due, you have to honor that. Thank you so much again, Honorable Forbes. And so we're going to move into our first discussion or first segment. Then we take a break for 15 minutes and then we will continue the program. Okay. Okay. Coffee break will be served, so don't worry about that. You can treat yourself while you listen to the valuable information. So, ladies and gentlemen, the first session we'll look at the governance structure in Sporting Federation. And at this time, Mr. Alan Beckford, who is the General Manager at the Sports Development Foundation, will deliver his presentation on this particular topic and issue. Please make him feel welcome, please.
Just stakeholder who is the athlete. If you, for example, go to the IOC Code of Conduct, the IOC code, let me get that name right on that one there. But they include in it, for example, that you must have an elected athlete on your National Olympic Committee. And the IOC have set these standards, and I think they're good standards for us to follow. So how many federations here have an elected athlete on your board? Put your hand up if you do. So one national federation is that with a hand up there? 1, 2, 3, 4. Right. So you have 4 of the number of federations here. So I think that's something right away we need to look at is look at our structure, see that we have a good structure. And we have long-term succession, for example. People. And I think this side is so important. And I'm just going to be very basic here. So we have an election for national federations. And we have 2 people running against each other. Both of them have multiple skill sets. They can help. But at the end of the election, do we recruit those persons who maybe did not win at the election? So what we need to do is to start to look at the skill sets we require, because some of the persons who are on the other side have the skill sets, and it's important that we ensure that all times we look at issues of engage with diversity of background, gender equity. How many of us on our boards have seen that we have sort of a 50-50 ratio? Do we have it within our constitutions to say that we need gender equity? This is something that is extremely important. We need independent thinking persons. My presentation today, and I'm going to ask Richard Martin to stand up here. Richard, stand up. Richard just recently graduated from the University of Technology. And most of this presentation was done by Richard because Richard is a bright young man coming up. And it's important that we recognize talent that is available. We can't just be using old fogies like me every single time to be putting on your board. You need to have you can sit down, Richard. You need to have fresh ideas and bright young persons who are going to come and help us. We recently, as the Sports Development Foundation, had a panel discussion which included sponsorship. And we went into other areas. We got somebody who was a party promoter to help us with our presentation, because it's entertainment and it's the same thing. So please, I'm emphasizing this issue of people. Can you reasonably say that you have gone out and got all the possible talent that is available to be on your board? Standards and conduct is really important. We need to set our standards, maintain the standards, because at the end of the day, your organization is being looked at from the externally, and you're going to be judged by this, and it's going to affect you. Policies and processes. You should be complying with all the applicable laws and regulations, consider the social and environmental impact of their decisions, undertake responsible financial strategic planning. And I'm just going to jump a little bit out of the slide here. So for example, Director Eisen is here, Senior Director, and we sit many times in pain in that you say you're hosting a Caribbean Championships and we get a proposal that only has an expense side of it. So there's no income on it. You give us these proposals a month or 2 before. Is that correct, Mrs. Eisen? And then, so it means you have not planned. Recently, and I was happy to hear that, and I will name the federation, the Table Tennis Federation has been speaking to us. Their championships is next year, and that's what you expect when you're planning. So you need to have your policies, your strategic planning should be done. How many federations here have a 5-year strategic plan? Thank you, question, and I'm not seeing you in the light there, but I'm happy that there are a number of federations that do have it. But it's something that we should have had everybody just putting up their hands at the same time. Compliance. Many of us have, as national federations, have been incorporated. Have we all every year fulfill the annual return, done our annual returns? Can we say we are fully tax compliant? So many federations come to the SDF to assist them with importing, but really you should have the flexibility to do it yourself if you are ensuring that you're fully compliant. And we at the SDF and generally government needs to ensure that our funds are being properly spent and that you are a reliable organization, a reputable organization. And I heard the issue of reputation today and the thing of anti-doping, but we're asking that you federations take a look if you need to speak to us. The ministry has a whole department to assist with this. We also at the SDF can help as well. Correct, Mrs. Ison? Why is it to be compliant with the AJ? We have legal compliance issues, tax compliance issues, and at the end of the day, we need to ensure that we are all contributing to national development. The Companies Office of Jamaica, I briefly spoke to that. All of us need to ensure that we are fully compliant. If you're not compliant, you can always have a conversation, as I said, with the Ministry of Sports Department, with the SDF, and where we can help, we'll try to help you. We spoke to Jadco, but I just wanted to lead aside here because this is one of the compliance issues that we need to look at. Recently, I was asked to assist with getting some athletes in an international competition. And one of the requirements is that all athletes who are competing internationally in that sport have to have gone to a WADA course. So it's not something that, so our Jamaican athletes could not have competed unless they went to a Jadco Symposium. Why is it important to comply with the cooperative and friendly societies? This goes without saying. The fact is that we are all non-profit organizations and we should all be registered, and it's important that we are fully compliant so we can gain the benefits which you can get. DPA, that's another issue now. How many persons have a data protection officer? How many persons have been understanding the data protection? This is, from a governance point of view, this is so critical. Many years ago, the European Federation, Europe started with the data protection, and it's important all of us understand that we have extreme responsibility when it comes on to protecting data. We collect data, for example, athletes' date of birth. We collect data of their addresses. We collect data about their family. So we are significant data collectors, and we need to ensure that we are doing something to protect it. I'm not sure how many persons have reached out to experts to get it done. We are also working on it as well too. So hopefully where we can, we will assist you. Your whole compliance and regulation, enhancing development programs. Now, most federations, and a very high percentage of the federations, we must thank you for having taken the time to provide your audited financials. It's important, for example, that your financials are taken to your AGM so that your members are aware of what is happening. We need to communicate with our members, because who do you report to as a board? The board of a sporting federation reports to its members, and ultimately at the end of the day, it's important that we remember who our first and most important stakeholder is, our athletes at the end of the day. Remember that when you were put there on the board, you may have been elected for some associations by clubs. You may be done by individuals, but at the end of the day, you report to your members. Safeguarding in sports. How many associations here have a safeguarding policy? Anybody put up your hand? Nobody? So I don't want to. We have to look at safeguarding in sports. This is something that is critical. As a country, how many athletes do we lose because of the various kinds of abuse? Mental abuse, physical abuse, sexual abuse. How many are we losing along the way? So all associations for good governance should have a safeguarding policy. Minister, is that correct? That's correct, right? You should all have a safeguarding policy. And you should be constantly updating your coaches, your athletes. Every single stakeholder in sports has a role in safeguarding, because it goes as far as how does the president deal with their board? How does the board deal with the athlete? How do the coaches deal with the athletes? We go away as teams. Do we all, for example, look at our gender equity issues? If that we all are constantly preaching the whole issue of safeguarding in sports. We have seen multiple issues worldwide, and the human race is the same everywhere in many ways.
Thank you once again, Mr. Alan Beckford, General Manager at the Sports Development Foundation. Ladies and gentlemen, it is always my pleasure, without a doubt, to welcome, I think, the hardest working minister. I don't care what you want to say. Good? And she's looking rather resplendent, as always, in her magenta, well-tailored outfit this morning. Ladies and gentlemen, please help me in putting our hands together to welcome the Minister of Culture, Gender, Entertainment and Sport, the Honorable Olivia Grange, OJ, CD, MP, and members of her team from the Ministry of Culture, Gender, Entertainment and Sport. And before we invite the Minister to make her presentation, we're going to move into session 2. And the session will focus on the complaint, pain management, and athlete health. And I know all athletes and support personnel in particular will find this very interesting. So ladies and gentlemen, leading this discussion, I'd like to welcome Dr. Paula Dawson, consultant, physiatrist, and sports medicine lecturer, as well as medical director, Rehabilitation Institute of the Caribbean Limited. Make her feel welcome.
Good morning, everyone. I'm going to ask for all protocols to be observed because we're running a little late. But of course, I have to say good morning, Minister. Not that you're my favorite minister, but we know. All right, so I want to thank Jadco for inviting me to present on the compliant. Although patients do complain of pain, but it's the compliant of pain management in the athlete, right? So I'm a physiatrist. Thank you, Master of Ceremony. You actually did very well. Most people always say physio who, physio what. I'm a physiatrist or physiatrist, depending on if you're on the east or west coast of the United States. So, interestingly, the year after that, 1953, Sir John Golden came to Jamaica as a lecturer and a doctor in orthopedics at UC, University College. And subsequently, the Department of Orthopedics was started. As far as I'm concerned, he is the father of rehabilitation in Jamaica. I might be the first physiatrist in Jamaica, but he's the father of rehab. So you have people that will choose only to do brain injury, pediatrics, spinal cord injury, and other areas in medicine. So today I am going to first do some definition. So I'm going to define pain. I'm going to talk a little bit about the etiology of pain in athletes. I'm not sure why I'm going in and out. Battery's dying. Thank you very much. So I'm also going to go through some of the WADA World Anti-Doping regulations and then treatment approach, which will be compliant with anti-doping policies and regulation, and then how to control pain and maintain clean sports. Now, what is pain? pain is an unpleasant sensation. Almost everybody, I'm pretty sure everybody in here would have felt pain at some point. It's an unpleasant sensory or emotional experience associated with an actual or potential problem. So you may not actually have tissue damage, but you might think you have tissue damage. I'm sure some of you will have pain before somebody even touch you. You twist up your body in preparation for the pain. So that is potential, and that's an emotional experience. Many years ago, it was thought of the process by which pain is where there's something that stimulates, something noxious. So we have different types of pain. There's physiological pain, which we call nociceptive pain, where, similar to man in the picture before, you activate some pain fibers, some C and A delta fibers, and it might be related to actual tissue damage or potential tissue damage. So there's withdrawal or there's guarding, so you just don't go that way anymore. Then there is something called non-physiological pain or pathological pain. Now, pain that goes beyond the normal threshold, and it serves a physiological purpose. What does that mean? It helps you to know that something is seriously wrong. For example, an appendicitis, you can't see what's going on in the gut, but then the pain is so severe that you know something is really going on. Then there's neuropathic pain. Now, neuropathic pain, people call me the pain doctor. I'm not the pain doctor. I'm the no pain doctor, right? So I like to say that, okay, if you come to me, you'd have to come to me for pain only, but when you leave, you should have no pain, right? So neuropathic pain is that pain which goes on even without you still having a stimulus. And I always tell my patients, if I pinch you for a year, that pinch creates a footprint in your brain. And when I stop pinching you, you'll still feel the pain. Now, what is happening along the pain pathway that allows you still to perceive the pain? That's what we have to treat. So it's not as simple as a noxious stimulus transmitting. Now you have something that's almost automatic. So here you have phase 1 of pain, a brief pain, something juke you, and then you feel the pain. Then phase 2, there's some swelling, inflammation, where you have a lot of chemical coming in and causing swelling and redness, rubor and calor, where it get warm, right? So that is persistent pain. So you start having inflammation. Now, when it continues, remember I mentioned to you before, where you have nerves, like what we call it now, upregulation, where the pain fibers are now heightened. So even feather touch you, temperature changes, you have some new nerve fibers jump over from the regular fibers, from your temperature fibers, from your emotional fibers, and they go along the pain fibers. And now temperature change, emotional change will also now cause pain through the dorsal horns, and it goes up to the brain. Now, that's all scientific. So let's talk about the pain in athlete now. Commonly, though, it's thought to be because of tissue damage. So there's an acute trauma in our athletes, whether it is a torn muscle, a knee injury, a strained ligament, a torn tendon, concussion, a hit in the head, a bruise, a cut, a laceration, spike, scrape of your foot, toothache, believe it or not. So athletes can still experience pain that you and I experience, right? From back pain, neck pain, toothaches, etc., or even dysmenorrhea, period pain. Women will have period pain as well, right? And so you can have an acute situation for the athletes where it's a regular tear or overuse. A lot of our athletes will have shin splints, as you guys know, which is the pain in the pretibial area, which is over the shin, or hamstring injuries or knee injuries. And then this can become chronic. But then you have multidimensional factors that can cause pain outside of the overload or the overuse, the overstretch. So you can have tissue overload, you can have nociceptive gain where it's upregulated because of continuous. You have cognitive. I'm sure some of the coaches will tell you that you have some athletes that feel pain more than others. Some athletes will get some injury and then grit and bear it, while other athletes will just twist up in pain. So there's some cognitive ability about it, the perception of pain, emotional. And I don't know if you know, sometimes when you're having a bad day, if something drop on your toe, it hurts more than when you're having a good day. So there's some emotional component and their behavioral component, and of course lifestyle and several other factors. Now, it's important for me to show you this diagram, not because I tried to turn you into chemists, but to show you that round square thing at the top, arachidonic acid, that chemical is the chemical that first start the process of perceiving pain. So that is in the cell membrane of the muscle or the tendon or the bone. And once you have disruption in the tissue, that acid starts to break down. Now that acid, it can be stopped by anti-inflammatory. You'll see some NSAIDs, diclofenac, we know cataflamor, Voltaren, or ibuprofen, Advil, or naproxen, Aleve. It can block the breakdown of that acid, arachidonic acid. And then you have some others on the right side with Celebrex and some other stuff. So if you can break the chain that would lead to some of these things, these PG, the prostaglandin, those are the things that will cause you to perceive pain. So inflammation and pain will come after you have the tissue damage. So where are we going to work to stop the pain in athletes will be along this pathway. So it's important for us to maintain clean sport while still treating our patient in a way that they're comfortable. A lot of people always say, why are substances prohibited? Well, it represents a potential to enhance or actually enhances your performance. Next part is that it actually or potential your health risk. Some people say, well, I don't understand why them Vanguard got marijuana. It's not like it's going to make you run any faster, but it might be a potential risk because it may have in chemical like THC that might alter your sensorium or your cognitive ability, and depending on the sport you're doing, because it's not just track and field where you run out of the lane because you're high, it might be that you're shooting that or archery or you're doing motorsports, right? So you have to maintain cognitive wholesomeness and health. And of course, it violates the spirit of sport. These are why substances are prohibited, not just because they boost you up and make you run faster, but that they may be at a potential risk or violates the spirit of sport. Dr. Harvey is going to be talking about the prohibitive list, what is new. But then I just have to maintain and establish the background of drugs that are banned all the time in and out of competitions, those that are banned only when you're competing, because this will determine how we manage the pain depending on where you are in your competition, right? So the WADA list is updated every January, and Dr. Harvey is going to go through that. This is what the categories for the prohibited list, and I brought this to show you the two main categories that we as pain doctors, you see me call myself pain doctor, right? As people who treat pain will have to be mindful of, right? And the narcotics, the cannabinoids, and the glucocorticoids. These are some of the things that we use to manage pain. So these are prohibited in and out of competition. Commonly, we have had and seen in the news internationally, athletes have been on oxycodone, Vicodin, or pethidine, or tramadol. Tramadol is commonly prescribed in Jamaica for pain. Tramadol mixed with Panadol or acetaminophen is called Tramacet. It is banned, prohibited in competition. And this doesn't necessarily boost your performance, but it numbs down your pain, and it can cause a lot of drowsiness and dizziness because it's centrally, and so this is prohibited in competition. Of course, you have the cannabinoids. So cannabinoids is prohibited in competition. Why? Because, of course, there's a risk for substance abuse. The THC, the tetrahydrocannabinol, which is what makes you feel high and nice. But there's an exception, which is something called cannabidiol, CBD oil. Everybody is selling CBD oil. Although it might be permitted, most times you cannot be sure that the CBD oil is free of THC. Exactly. So we call it ganja, we call it cess. It acts on the brain cell to decrease some brain function, right? But we cannot be sure that what you are buying is pure enough. And so for me, I tell my patients, stay away from CBD, right? Athletes should be aware that some CBD products, extracts with cannabis plants can and still will contain, even if it's 0.1% of THC, it can be picked up and it will be an analytic finding. Now we go to the big category. This is the category that we always get a little confused. The steroids, the glucocorticoids, not the anabolic steroids. You have another group that's banned in and out of competition, but this is the glucocorticoids. This is like the prednisone or the things that you inhale, right? So we have dexamethasone. These are the type of steroids that if you have an inflammation, say for example, you ate shrimp or you ate or bee sting you and you're allergic and you start swell up, they'll give you this steroid to kind of save your life, right? To quiet the inflammation. So we use this a lot for inflammation. Now, prior to 2022, you could use it in competitions with some requirement. However, subsequent to that, all injectable routes are now prohibited. So you cannot use this kind of steroid, whether IV, in the muscle, in the joint, interarticular, around the joint, or around the tendon, peritendinous, or in the tendon, intratendinous, epidural. As a matter of fact, one of our athletes back in London had a back pain and ended up having an epidural with steroid, which at the time was appropriate. So for me, I treat a lot of patients now with back pain, herniated disc, pain going the leg with epidural steroid injection. But if you're in competition, you're not allowed to use this, right? Whether it is around a lesion, a bursa is like a sac that kind of cushions the tendon. You always hear people say they have bursitis in the shoulder. Sometimes we inject the bursa for pain, but we can't do that anymore, right? Sometimes you can also do intradermal, which is under the skin. Can't do that anymore, right? So it is not allowed in competition. However, you can use it, but you have to adhere to what we call a washout period. What does that mean? You have to do it well ahead of when you're going to compete, 11:59 p.m. the day before you compete. And so, for example, oral steroid, if you're going to take it by mouth, it has to be 3 days. Triamcinolone, as you know, which is the one I use a lot, is a potent anti-inflammatory, 30 days because it takes a while and it's in your body, right? Intramuscular, you have the 5 days. You can move on to the next slide for me. Well, you're way behind. Right, that's where I am now, right? So intramuscular. So go back to the other slide. So I was explaining before, so these are since January 1. Prior to that, you could use some steroid, but since 2022, all injectable routes are now banned. So let's move on to the next slide. Right, so now there's a washout period. So you can actually use steroid, but you must have a washout period, all right? And you have to adhere to this. And you should also declare it and state when you last took it. You usually have the doctor, the physiatrist, or the neurologist, or the orthopedist. Then you will have the physical therapist because you need motion. Motion is lotion. You have to move to move. If you don't move, you won't move. Then you may need some psych, biofeedback technique, because sometimes it just is for you to understand what you're feeling is not really damaging the tissue, and for you to kind of get past that point and kind of reset the thermostat or the level to which you start perceiving pain to be harmful. So let's go through them. Acetaminophen, can you use it in and out of competition? Yes. We don't know how it works fully. We think it works through the CNS, central nervous system, to reduce pain and fever, which is kind of a good side effect if you have fever as well. What do I mean? Well, of course, you guys know what fever is, but whenever you have an inflammation, don't you always get some warmth? Like when your foot swell up, you get warmth, right? So it helps to bring down the temperature in that area. And it may reduce. Remember that COX thing that I showed you in the diagram when you have the arachidonic acid at the top? So we believe that acetaminophen, which is panel, kind of helps with that, right? But it's a weak inhibitor of that enzyme, which allows you to go down all the way through the pain cascade to produce those PGs, the prostaglandin. Those are the pain chemicals. So if we can prevent pain chemicals, we can prevent the perception of pain, right? So the NSAID slide, right? So anti-inflammatory. NSAIDs mean non-steroidal anti-inflammatory drugs. Yes, in and out of competition. There's so many of them. Aleve, naproxen, celecoxib, cataflam, diclofenac, NICE, aspirin. And so they are useful. The problem with them is if you use them too much, they can irritate your stomach and cause gastric irritation, and then you have a secondary pain. Muscle relaxant, a lot of times athletes will have muscle pull, and when the muscles pull, whether it's in the back, they also get spasm in the muscle, so they're not up. I'm sure some of you would have had felt a pain in your neck at some point where you have your muscle tight up and you wake up and you can't turn your neck from left to right, or you can't straighten up because your back is killing you, well, you may need a muscle relaxant. Unfortunately, all of the muscle relaxants are allowed in and out of competition. The only thing is they kind of slow you down. Norgesic, I find, one of my favorite drugs to prescribe, it kind of make you feel kind of sleepy-ish. It has in acetaminophen as well. If you Google it, the old one that was manufactured by another company had in aspirin, but this one does not, and Midocalm. I would think that Valium would be not allowed during competition, but it is, believe it or not. Diazepam. Nerve block, which is done under X-ray guidance. So you bring the patients into the operating theater or an office that has a machine called a C-arm, a special X-ray machine, and you're able to see through, when you see the X-ray, the bone alignment or the knee alignment, and you line it up and you push the needle right in the area or the muscle. You can do it on the ultrasound guidance as well, and you inject with lidocaine. Again, I find it numbs the area, but it serves as a washout to help those PGs. You remember those prostaglandin, the thing from arachidonic acid, to help pain management. Steroids in competition, no. Steroids out of competition, yes. Washout period. And why I have steroids back here is because sometimes we inject it. Now you have something called radiofrequency ablation. Essentially, it's burn the nerve. They just put some electrical wires on the nerve and burn it. We have some orthopedic surgeons in Jamaica who do it. Some patients who have knee pain refractory to every treatment. No matter what you do, you still have the knee pain. And so you can see that in the diagram, though you have a drawing, and then below it you have the actual electrodes that they put around the geniculate nerve, which is a nerve which goes to supply the knee. Again, remember I told you, if you don't have nerves, you can't feel pain. So we block the nerves. We also do it for the back as well, for the sacroiliac joint as well. They also do spinal cord stimulator. We don't currently do spinal cord stimulator in Jamaica. What is a spinal cord stimulator? Well, patients that have pain, chronic pain, have had surgery, we don't know what to do after that. We actually put, and you see that the skeleton, we have spine and the pelvis, we put a wire with some electrodes, some actual electrodes, and we lay them on top of the spinal cord. And there's a transistor that we put under the skin, or sometimes outside of the skin, where you can control the stimulus. So what happens is it keeps stimulating the nerve and kind of blocking the pain pathway. So remember, nerve electrical stimulation is pathway of nerve pain. We can also do peripheral nerve stimulation. We can use a topical one, the sticky pads where you put on and you stimulate sticky, or we can put acupuncture needles in the muscle and then put an electrical current on the needles and stimulate the muscle. The muscle will jump and it will help. It can help the pain. Everybody's asking about PRP, platelet-rich plasma or platelet-rich fibrin. What is that? They take your blood, they spin it down in a centrifuge. For those of you who know that centrifuge in the diagram is the one in the middle, and it separates the different components of the blood, and we take out what we call the platelets. The platelets are some little pinkish round circles, much smaller than the blood cell, and they're used in the blood to help you to clot. So if you don't have platelets, you can't clot your blood, so you bleed to death. But we found that the platelet has some growth and healing properties. And so when we take out the platelets and we inject it back, we find that the patients tend to do very well. You can put it anywhere. You can put it in the joint, you can put it around the tendon, you can put it in the muscle. Now they're using it in the face for wrinkles. They're using it for erectile dysfunction in the penile shaft. So PRP is used for many things, but we used a lot for pain, and the patients actually do well with PRP. Here you go, just the essentials of how you do the testing, but I think Dr. Harvey is going to go through that with you. I hope you guys got some information from this lecture outside of being exposed to some whole heap of scientific words, arachidonic acid, cyclooxygenase, but essentially it's important for you to know that we can control pain without cheating and still being quite compliant and continue to dominate the athletic field. Bless you.
Listen, this is a whole lot to take in. And when you listen to Mr. Beckford's presentation prior, and you listen to Dr. Dawson's presentation, you can't help but to thank the ministry that is under the guidance of Minister Grange. And you can't help but to thank Jadco under the guidance of Mrs. June Spence-Jarrett, chaired by Mrs. Debian Brown Salmon, and the other stakeholders, including the athletes and the athlete support personnel, for constantly protecting the integrity of our sport. And I believe that you need to give yourselves a big round of applause, because it's not easy to do. It really isn't easy to do. And ladies and gentlemen, the conversation continues now. And we're going to look at the role of Clean Sport, Jamaica's global brand. And who is better to present this topic than the minister herself, the Most Honorable Olivia Grange, OJCD MP. A big round of applause, ladies and gentlemen.
Mr. Adrian Atkinson, Master of Ceremonies. Honorable Ian Forbes, First Vice President, Jamaica Athletics Administrative Association, and Custos of St. Andrew. Mrs. Debian Brown Salmon, Chair, Board of Directors, Jadco, and all the other members, all the other directors who are here this morning. It's interesting that I appoint the Board of Directors, but I'm sitting there and I'm looking around to see the directors who are present. And there is one director sitting next to Mrs. Salmon, and I'm saying to her, who is that lady? Although I appointed her, but it goes to show that I don't even have to know the directors personally, but they are recommended for their skills and expertise, and I accept those recommendations and appoint them. So we really have a very good board at Jadco. Mrs. June Spence-Jarrett, Executive Director. Mr. Alan Beckford, General Manager, Sports Development Foundation. Dr. Paula Dawson, Consultant Psychiatrist and Sports Medicine Lecturer. I really going to ask if you could give me a copy of your PowerPoint. Dr. Anna K. Harvey, Jamaica Medical Doctors Association. Sports federations, I understand there are about 27 sports federations represented here. Distinguished guests, athletes, coaches, stakeholders, media. I'm pleased to be with you this morning at the Jamaica Anti-Doping Commission's 2025 Symposium. This year's theme, Clean Sport, Shaping Jamaica's Global Reputation, is both timely and important in terms of our nation's future in sports. Jamaica is a global leader in athletics, boasting a legacy of excellence. From legends like Usain Bolt, outstanding women like Shelley and Fraser Price, to the rising stars who continue to inspire. This legacy is built on hard work, discipline, and most importantly, integrity. Clean sport isn't merely about winning. It's about winning with integrity, fairness, and transparency. It's about upholding the values that have made Jamaica a respected force in global athletics. In fact, there was a time way back we would be the most tested and all kind of rumors. Now we are above all of that, and they can't test us and find anything. And we should applaud ourselves. In an era of heightened scrutiny, the global demand for clean sport is undeniable. Jamaica has the opportunity and indeed the responsibility to lead by example, and we are doing so. Jadco plays a vital role in this effort, and as Minister of Sport, I'm pleased with the significant milestones Jadco has achieved. And I really want you to put your hands together and applaud the Jamaica Anti-Doping Commission. Now, the milestones that Jadco has achieved include, and I will list some of those, the ISO 9001 2015 certification. This demonstrates Jadco's commitment to quality and adherence to international standards. In fact, research indicates that no other national anti-doping organization has been recommended for ISO 9001. So we are leading the way in that regard. Full water code compliance. This ensures Jamaica's anti-doping program meets the highest international standards. And we are the flagship organization in this region for WADA. You must clap yourself because you're doing good things. Leadership in testing. Jadco now conducts the highest number of blood and urine tests in the Caribbean, reflecting a proactive and robust approach to testing. The highest number of blood and urine tests in this region. Comprehensive organizational structure. Jadco boasts a fully equipped operational facility and a comprehensive organizational structure, enabling it to effectively execute its mandate at a national level. Someone said to me the other night at netball, them said Jadco is here too. I mean, everywhere you look, you see Jadco. We also can boast about a strong education and communication strategy. Jadco has a well-established public education program and has been recognized internationally for its best practice in this area. I had to say to the ED the other day, I want you to tell me your secret. How do you have such a strong public education and public relations program on such a small budget? Give me the template, because I want the ministry to do the same. Government support. The government of Jamaica, and with me as your minister, your number one cheerleader, we fully support Jadco's mission with a dedicated annual budgetary allocation. And I'm telling you, Jadco has done wonders with the allocation that we have given the organization. And we always make sure they get what they need. Mobile testing unit. Jadco is one of only 2 national anti-doping organizations in the world with a mobile unit. Jadco has enhanced reach and accessibility island-wide because of that. Which is the other country, Miss? Is Japan. See? Jamaica, one of 2 in the world with a mobile unit for testing. International training collaborations. Jadco is proud of its international training collaborations with renowned organizations such as the United Kingdom Anti-Doping Organization, the Canadian Center for Ethics in Sports, and the United States Anti-Doping Agency to leverage their expertise in communication and education, further enhancing Jadco's educational programs. Annual Impact Study. Jadco continues to conduct its annual impact study, a crucial component of the decision-making process for its educational programs. And this ensures that these programs remain effective and impactful. In terms of global recognition, in recent years, Jadco has been invited to present at symposia and conferences convened by both the Institute of National Anti-Doping Organizations and the World Anti-Doping Agency, WADA, and has been recognized for its work, demonstrating Jadco's growing international influence and expertise. These achievements demonstrate Jadco's dedication to safeguarding clean sport in Jamaica. Now, ladies and gentlemen, moving forward, Jadco will be implementing several key initiatives to further strengthen its capabilities. And these include expanding the sample collection pool. Jadco will pursue partnerships with wider government entities and the private sector to establish a robust pool of sample collection personnel through a national duty program. And so the idea is to bring in both government and public sector personnel and for them to be treated as individuals who have a national duty. So when they are called on by Jadco, the entities have to release them to go out and serve the needs. And it's important because as we widen the pool or the testing pool of personnel, we have to make sure we have the team that can go out there and do the job, get the job done. We also will be looking at enhancing intelligence and investigative capabilities. Jadco will be finalizing a memoranda of understanding with local and international partners, including, and we're not calling the police, but we're going to include strengthening our relationship with the Jamaica Constabulary Force and the Jamaican Customs Agency to strengthen its intelligence and investigation activities. And I want to emphasize that there was a time in the past when Jadco was seen by the athletes as the police. That no longer exists. Jadco is there to protect the athletes and to make sure the athletes understand the whole process through which one has to ensure that we promote clean sports. So the more education the athlete gets and the stakeholders, it's the more they will understand the process. And so Jadco is no longer seen as being against the athlete or like calling the police, but rather Jadco is now seen as a friend and as a guardian. And I really want to commend Jadco for getting to this point where there is now a wonderful relationship between the sporting organizations, the athletes, and Jadco. Jadco will also be expanding its contract testing and training services to other national anti-doping organizations, sharing its expertise and contributing to the global anti-doping effort. And it was a week ago or so, we were at the WADA Regional Symposium, and we invited our Caribbean ministers, Caribbean countries. We invited them to make use of our training programs. We're inviting them. We're willing to train their personnel when we do our programs. And so we have a very special relationship now with over 10 Caribbean countries in the region, where we are helping them to strengthen their anti-doping program. So these initiatives will further enhance Jadco's capacity to effectively combat doping and ensure a level playing field for all Jamaican athletes. Maintaining our leadership in clean sport requires ongoing vigilance, education, and strong collaboration. Our athletes represent more than themselves. They represent Jamaica's commitment to fair competition and ethical conduct. When the world sees Jamaica, we want them to see not just talented athletes. Yes, we know we are talented. But we want the world to see a nation that values integrity and upholds the highest standards in sports. Clean sport is about preserving our legacy and securing the future for generations to come. We must ensure that young athletes understand that their success will come from hard work, will come from dedication and ethical practices, not from shortcuts. However, clean sport is not solely the responsibility of athletes. It involves sports organizations. It involves coaches. It involves the federations and every individual involved in shaping the sporting environment, including parents of athletes. We must create a culture that prioritizes integrity, where athletes feel supported in competing fairly and know that they have the resources and support to succeed without compromising their values. Today's discussions should inspire action. Let us move beyond listening and learning. Let us translate the information garnered today into concrete actions. Each of us has a role to play in fostering a clean, fair, and equitable sporting environment. So, I say to all of you today, let us work together to ensure that Jamaica's athletes compete on a level playing field where only talent, hard work, and discipline matter. Let us continue to build a nation where clean sport thrives, where every athlete can reach their full potential in an environment of fairness, integrity, and respect. I really want to thank you all for coming here today. I'm really impressed with the turnout. And to say that continue, Jadco, go from strength to strength. Want to congratulate our sporting federation and our athletes, our administrators, and all stakeholders for the contribution that they're making to make Jamaica look good as a country that promotes clean sports. So thank you for your attention and dedication to this vital cause. Blessings.
Minister, we want to say thank you in words and in deed. So I'll just welcome Mrs. Jones-Smith-Zarrett.
Good morning. All protocols observed. I'm told to introduce myself. I'm Shanette Stubbs and I am a director of Jadco. Okay.
And an attorney at law.
Okay, Minister, it is my pleasure, my honor to be given this privilege to thank you today, and you are looking wonderful. You have really committed and dedicated yourself as a minister to the Jadco body, and you continue to work hard and diligently, and you continue to offer us much guidance and support in everything that we do as a board and with Jadco on a whole. And I'm here just to thank you and to let you know that we certainly and truly appreciate everything that you do and continue to do. May God continue to bless you, and we look forward to working with you, and thank you for being our biggest cheerleader. Thank you.
I don't know how Mrs. Jarrett does it, but somehow she always finds a way to get gifts. I don't know how she does it, but thank you, Holy, for walking with this morning. My hands full. Thank you so much, and God bless you.
And Thank you once again, Minister. Another round of applause, ladies and gentlemen. I'm sure you're curious to know more about this. And it's what's new in the 2025 water prohibited list. To lead this discussion, I'd like to welcome Dr. Anna K. Harvey from the Jamaica Medical Doctors Association. And may I invite you to also look inside of your kit. You will see a copy of the list. It's also included. And I'm asking you to peruse the list carefully. So please welcome Dr. Anna K. Harvey, ladies and gentlemen.
The 2025 water prohibited list. So what's new? We'll be looking at updates to this list. We're going to look at substances prohibited at all times. And these are non-approved substances. Now, non-approved substances is any pharmacological substance which is not addressed by any of the subsequent sections of the list. And it's the current approach by government, regulatory. Okay, so non-approved substances are basically any pharmacological substance which is not addressed by any of the subsequent sections of the list, and with no current approval by any government regulatory health body for human therapeutic use. Example, drugs under preclinical or clinical development, discontinued drugs, designer drugs, and substances approved only for veterinary use. These are prohibited at all times. So here are some examples of non-approved substances. And by the way, these examples are new in the guidelines prohibited list. So you have S107 and S48168. Now, in general, this category includes substances that are not specifically indicated on the prohibited list. So if a substance is not approved for clinical use by any governmental regulatory authority and has enhancing potential, it may be prohibited under this category. So with regards to these two new examples, S107 and S48168, these are experimental compounds that stabilize ryanotidine receptor 1 calstabine complex. And this is a complex that's found in your muscles, your skeletal muscles specifically. And the disadvantage is, why it's cheating, is that it enhances muscle performance. So thereby, if it enhances muscle performance, it will lead to endurance in an athlete's quicker recovery. And this is cheating. So moving on to your anabolic agents. So anabolic agents are steroids, are basically they build muscle mass and fight inflammation. So we're going to look at the side effects. You have your general side effects and your specific side effects. So general side effects include potential for liver and kidney damage. You may develop high blood pressure or diabetes. There's also increased risk of developing heart disease, and you can become addicted. Those who have acne already, it can actually worsen your acne. Now, side effects specific to males, it may lead to shrinking of testicles and impotence. For the woman, it may cause her menstrual cycles to be abnormal, and if she's pregnant, there can be damage to the fetus. Next, we're gonna look at peptide hormones, growth factors, related substances, and mimetics. Now, these substances work similarly to the effects of anabolic steroids. There's EPO, which works like blood doping, and HGH. I'm going to explain these further. Now, EPO, or erythropoietin, is a hormone secreted by the kidneys that increases the rate of production of your red blood cells. And in response to that, it causes an increase in oxygen to the tissues. So the most medical use for this condition is for persons who have anemia or low blood count, which is related to kidney dysfunction. Its overall effect is to increase endurance, and in athletes, it is used mainly by long-distance runners and in cyclists in over 80% of the cases. It is injected underneath the skin. So therefore, you might imagine the more red blood cells that you have in your body is the more oxygen that's going to be delivered to your muscles, thereby enhancing endurance. So of course, it's going to delay the onset of fatigue, meaning an athlete can run harder for longer periods. And side effects include clotting, heart attack, and stroke. Now, HGH, or the human growth hormone, is a peptide that stimulates growth, cell reproduction, and cell regeneration in humans. Practical implications of the 2025 changes. There is increased testing for new substances, for example, T-sulfensin, stricter dosage monitoring for formoterol, heightened scrutiny on experimental peptides, greater collaboration between athletes and support staff. Resources to stay informed include the WADA website, as well as the 2025 Jadco Prohibited List document. Mobile apps for substance verification include the Global DRO app, and also educational outreach programs like this one. The next steps for stakeholders include schedule meetings to review changes, conduct more anti-doping education sessions, develop compliance checklists, and strengthen communication with medical teams. In closing, athletes must always be aware what they consume and remember the strict liability principle. Be aware of your rights and responsibilities. Always have a copy of the prohibited list on hand. Tell your doctor or pharmacist that you are a professional athlete and should not be taking prohibited substances. And lastly, you don't need dope to cope.
Another round of applause, ladies and gentlemen, for Dr. Harvey. I'd like to extend a warm welcome to Dr. Rose. I can laugh, Dr. Rose. Dr. Olivia Rose, who is a licensed applied sports psychologist. And I might add that Dr. Rose is also the shadow spokesperson on sport, culture, and entertainment. Allow her to feel welcome, ladies and gentlemen. Before we invite the Executive Director of Jadco, Mrs. June Spence-Jarrett, to just provide you with the information concerning Jadco's achievement to 2024, I invite you to scan the code at the back because we need to hear from you. Fill out the form once you scan. We want to hear more from you, and so you answer whatever questions that are being asked. And there will be a question and answer section or segment after all of this. Before Mrs. Jarrett comes to make her presentation, we just want to acknowledge, and it should have been done prior, that we have Caribbean government ministers who are tuning online to this symposium. And we want to make them feel welcome, as the minister had said, that we had invited ministers from other Caribbean territories to be a part of our training sessions. And so we welcome them and we appreciate the fact that they are actually being a part of this symposium. So ladies and gentlemen, give them a round of applause. I know they are listening, they're watching, and we appreciate their company at this time. Mrs. Spence-Jarrett, are you here? Where are you? 5 countries are tuning in. So we want you to now tune in. We want to, Mrs. Jarrett, I'll tell you.
Another one comes into play where we now have to do what we have to do and answer. For us to remain compliant, we must state what we are doing. And we not only have to say it, we have to prove to them. We have to send documentation to prove that we are remaining compliant. Now, when I spoke, I mentioned that we are now ISO 9001. We have been recommended. We have done some time with it. It's a long, tedious process, but we managed to overcome. So when you walk into Jadco's office now, you not only see our mission and our vision and our core values, you see our quality policy statement, which was signed from March 2023, and it must be signed by the executive director. So it's right on our wall as you enter, and it says, the management and staff of Jadco are committed to fulfilling our mandate in keeping sport clean and protecting brand Jamaica. To maintain and improve this, the Commission commits to, and you have their deliver quality, effective, and efficient services which will meet and exceed the expectation of customers through improved testing, education, and training programs. This will be driven by the intelligence and investigative process. We promote and protect the integrity of sport as well as the health and rights of our athletes. We develop employees' competencies, creativity, and accountability through innovative programs, strong leadership engagement, and commitment. And achieve a high level of customer satisfaction while conforming to the requirements of ISO 9000 quality management system standards and the relevant statutory and regulatory requirements. We are presently conducting our customer satisfaction survey. So you associations and federations and sports club, when you see us send you the survey, please answer and return to us. It's important because this will help us to improve our delivery of service. Now, I'll try to highlight some of the 2024 programs that were very, and we would say, successful. And we look at our key achievements. We had 2 road shows. 2023, we celebrated 15 years. Arising out of that 15, and many of you, we paid courtesy calls and the association. We had a number of programs. We had our first road show as well as our first health and wellness fair. And because of the demand for it, we have done it again last year. So we have done 2 road shows. The first one took us from our first stop from Kingston. The first stop was in Oteria Square. Then we went on to Montego Bay. It was tremendous. We had over 500 persons who came out in Montego Bay at Sam Sharp Square. And in Oterias, we had actually the same. And the person who promoted our ambassador was his new name is Agent Sasko. And it was really very good. We promoted by giving the school children, we targeted them with water bottles and knapsacks. Then we had this first world show at our first health fair at our office, which was extremely good. And then the demand came again, so we did a second one in May last year. The second road show, we stopped in Mandeville and then moved on to Westmoreland, Savannah Lamar. And this time we targeted the students of the high schools and all-age schools and primary schools in the parishes. We had competition. It was extremely good. During this time, we walked the streets of Savannah Lamar from down at those persons who know South. We walked down from the market straight up to Manning's High School, the Manning School. And we handed out brochures and spoke with persons. Some persons said this is the first time that they were hearing about Jadco. And so we think that we should take Jadco to the people if the people won't come to Jadco. So this is the approach. And we have instituted a new compliance unit, which included audit. We now have a senior auditor and an auditor. We have a risk and monitoring management analyst, risk management analyst. We have a director of compliance. We have a senior monitoring and evaluation officer. We have a senior legal officer. We now have a perfect unit for that, as well as our procurement unit. We also must report too that we, Jadco, now have their data protection officer, and she's sitting over there. Just raise your hand. And she is now in place, and she she's a legal person also, but she's a data protection officer. All right, so all that is in place right now. So Jadco is moving along. We are safeguarding the health and safety for the commission, and we have interviewed an occupational safety and health officer, which this post was created and approved by the Ministry of Finance, and we have also conducted the interview. We are reintroducing the arts in anti-doping awareness. With the launch, we did the dub poetry competition amongst secondary schools, and this was done throughout the region. Region 1, Region 2, Region 3, Region 4, and we also have winners in those regions from the high schools. We are invited by GC Foster and other colleges. For us, they have an anti-doping program, and we offer ourselves to do lectures. I did the last one at GC Foster along with the sample collection and testing manager from Jadco, and we are availing ourselves for that. We have, as I mentioned before, that we have been recommended for ISO 9001. And I'm sure I remember when I came to Jadco, first request, Mrs. Blackwood was there. When are we going to get all our programs certified, right, Miss Blackwood? And we tried. 1 year, no money was there, and we tried until, and I'm sure she's happy to hear that we have reached the last stage where we are waiting to get our certification in our hand so we can have it placed on our doors and on our letterhead and whatever we do. So I'm sure you're happy about that. And if you move across, you'll find that we are everywhere. If you go on the streets, the billboards are there from Negril Point to Moran Point. If you go along there, we are there. And we must tell you that if we don't have a billboard there going to the parishes, we are on the bus shed. You must see us. The JUTC buses, you must see us. We're branded from behind, we're branded from the side, so any position you're in, you're expected to see it, because we must spread the message. Ignorance is no reason to break rules and laws. Correct? Good. I don't hear anybody answering me, man. No, we are moving forward, because we are now putting up our billboard in the national stadium. So when you come through, and I'm sure Mrs. Eisen is happy about that, because she know I've been begging and pleading, I will major say, all right. And we did a sign, it will be up by next week, any day next week. Print does it for us, it will be there. As you walk through the McDonald Tunnel, you will see Jadco right there. You can't miss Jadco. Huh? Good, and so we are proud of that. Now, I have also discussed it, and I think my chair is aware of it. We're trying to position, that's the last one we're doing, because, the money a little tightish. So we want, when you are leaving the airport, we want to have one right there. So we are negotiating, and that's the last one, because this I don't have any more money. So we're there. So unless she give me some from our sports policy, right? So when you are, athletes can't say them no know about Jadco. We do it all over. We do it on television. We have it on the radio. Everywhere you go, we're spreading the message. You know, I was going through Coronation Market and I saw an umbrella and it looks familiar to me. And I said, no dope to cope. And when I got up, it was a student from Tivoli Gardens High School. So anywhere you go, you must see the message. You cannot say you don't know about Jadco. We are visible, very visible, right? No, we have done international training with CCS because I have gone up there with 2 other members of staff, and right now we have a terms of reference where we are sharing training. We are looking at best practices, and this is between CCS, USADA, and UCAD. And I spoke about the impact study, and we have conducted 2 so far. And if you look at our statistics, I think they are going, so folks, our booth setup, what we have thought, we said we would do, we have exceeded that amount. And this is what we do. So the education team would go out there and set up booths. And they do their thing, handing out flyers and so on and so forth. Now, in order for us to keep tab and ensure that all athletes are exposed to training, because we try to train the athletes before they're actually tested, we have developed a questionnaire that is administered, and usually I sit at the front, so I usually give it to the athletes. It tells you how many sessions have you attended for the year. If you don't attend any, it goes back to the communication and education division, and they would assist it and assess it and evaluate it and give it back to us, and then we have to target those athletes. And also we have another question here which states, how many times have you been tested? Were you exposed to education before being tested? So we have all of that, and this helps us to improve the services that we offer. And all this is done because of our ISO program, because remember, ISO, we have to do an audit, and all the divisions, we have trained auditors who go in and look at every division to see if they are complying. And so everybody have to do what they have to do. And I know the federations here will tell you that if they're calling us, if it's morning, Sunday evening, Saturday morning, Saturday evening, right, we are there, right, Mr. Blair? We are always there. And sometimes the weekends are hard for us because we have to be out there Saturday and Sunday carrying out the mandate. All right? Our athlete works, the personnel who attend our workshops has increased in numbers. And this came from, it was a 100 that was proposed in our strategic plan and our operational plan. And we have exceeded it to 205. And the athletes who attended, we proposed that it should have been a certain number. And again, we have exceeded that number. Our blood sample, we have exceeded it every year. Even during COVID, when all the other countries in the Caribbean were not doing, I remember Maria calling up a meeting with all of us from the Caribbean and Latin American country. Jamaica was the only country that was still conducting their COVID tests during COVID, because we had developed our protocols and we were abiding by the protocols. So we have exceeded our urine test, we have exceeded our blood test every year, and as Minister mentioned, we are the lead in terms in the Caribbean, because the next country who comes after us was less than 50%, right? Right, Chair? Good. So we are moving on, and the guys will say we are motoring on and trying to do our best. Now we have some annual initiatives, and this is one of the which we do every fourth Thursday of January. Then we have our school tour. We, between February and March, and sometimes we go over into April, we do our school tours. When we have our senior, junior workshops, athletes workshop, some of these schools, because of where they are not able to come out. So next month, February and March, we are into St. Thomas and Portland. We are going into the schools. And in May, we are going to be having our road show. May is our health fair, and September is our road show. And the Junior Athletes Education Workshop is in October, and we start with Region 1, then to Region 2, Region 3, and Region 4. And if I might just tell you, Region 1 is Kingston and St. Andrew, St. Catherine, St. Thomas, and Portland. And Region 2 is Clarendon, Manchester, St. Elizabeth. Region 3, Westmoreland, Hanover, St. James, and sections of Trelawney. And Region 4, we have St. Anne, sections of Trelawney, and St. Mary. That's it. I think we have covered that. And then our Senior Athletes Workshop is in November of every year. But during that time, anything that comes up, any request that comes up from the associations and any request that comes up from the schools, we are there to conduct our workshops with them. I will also mention that we're going to be starting the Parent Teachers Association education program. We started with JC, and we're going to move into the other schools because we are thinking that the parents need to know what is happening. It's not because sometimes what comes up, and I have an open line to all of the associations and an open line to the athletes. And so I will get a call. I think what we're doing here, we are expanding anti-doping education to include the primary schools. So we are going to renew the discussion we have with the Minister of Education so that we can have that established on the curriculum. And we mentioned the expanding the Parent Teachers Association initiative to involvement of parents and teachers in the anti-doping awareness campaign. We are expanding contract testing. We are offering other Caribbean countries. Already we are doing for CCS, UCAD, USADA, and Bahrain. And we are expanding that to include other countries. And as we said before, we are established anti-doping in our sporting federation. We must have, and I want the association and federations to listen to this, we must have an anti-doping officer designated to talk to us, because sometimes the heads are busy. They must talk to us about what is happening in there. Sometimes we can't even find some of the athletes. We have to go through you to help us. And some association, I just said it when we were outside, we have great relationship now with the association and federations. And how did this come about? We have our established courtesy calls where we go in and speak to them. Tell us what are the problems you're having. What can we do? What can you do to help Jadco? And arising out of this, the relationship has changed and we are having much more dialoguing with everybody. I must say and I emphasize again, many persons will say, why do you do ISO 9001? And why do you want a quality management system? And I just want to highlight some points at the back. It says, ISO 9001 outlines requirements for a robust quality management system, which help NADOs manage their operations efficiently and consistently, including procedures for testing, data analysis, and communication with athletes and stakeholders. What it does again, credibility and trust. Achieving ISO 9001 certification demonstrate NADO's commitment to quality and adherence to international standards, enhancing its credibility and trust within the sporting community. The ISO 9001, what it does here again is customer focus. The standard emphasizes a customer-centric approach. So an ISO 9001 certified NADO would prioritize athlete needs and feedback in their anti-doping operations. We need to work together, and this is why Jadco is trying each time. We're not perfect, but we are trying to get it to you, and your input is very important. It is very important. And don't think we have, and you hear Minister said that, we don't think we have a large budget, but we manage, because it means that you have to do prudent spending and prioritize. I often say for the first and second quarter, I spend like a pauper, and picking up on the third and fourth, I spend like a king. A queen, but I like the king. And I close with a quotation from Jay Danzy, who says, "Your smile is your logo. Your personality is your business card. How you leave others feeling after having an experience with you becomes your trademark." This is Jadco's mantra. I thank you. Collection kit. And I know that we as Jamaicans, when we are used to something and we're used to something, when we get a new one, then we are going to question it. The first one we had, and those athletes who are in the room and some of the association persons like Mr. Blair and others and Damien and others who are here, know that it was heavy and cumbersome. No, Berlin just introduced one that is lighter, is the same value. Nothing has changed, but it is not made out of hard, breakable stuff. So we are going to be going around. This is the next thing we're going to be introducing that to the athletes and the federations and associations. I will now take questions or hand over to you, Mr. Chairman. Any questions? There's a, where is the PR, Miss Love? Can you, Mr. Blair, can you take a microphone over?
The blue one, folks.
Greetings, good afternoon. Madam, just in case that you intended for this prohibited list to be read by young and old, kindly ensure that the font is readable. Gratitude.
Especially, we wear glasses, so it can, let me tell you what happens. It's a long list that comes, so you have to put it, for it to be printed by the printery, they have to bring it down to a size, but it is readable. And if, pardon me? Yeah, coming to that. And this is, what we do, is because we ensure that you have this in your hands. But if you go on the WADA website, it's there. If you go on the Jadco website, it is there. It is available online in addition. So, and everybody, if you notice, every student have a computer, not a computer, cell phone, right? They're always having their cell phone. And what we do when we go to the schools and we send it out, we ensure and let them know where it can be found. So it can be found.
If you said in your presentation, that you intend to reach the parent. Now, as a coach, I'm sharing with you. You don't have to take it.
Name and your association.
All right, I'm Coach Babatunde. I am a football coach. I am just sharing this with you as someone who has to deal with the parents of our ballers all the time. This here is readable for adults and young people. The font is quite clear. If you put this into a parent hand, it's a turn off immediately.
No, what
Take
we're
care.
going to do, we're not going to give that to the parents to read. When we are having our Parent-Teachers Association meeting, we are going to have a PowerPoint presentation. And it's going to be bold, where we are going to be there and explaining it. And usually we partner with JMDA. Where's Doc? Where is Doc? We always have our JMDA personnel who goes with us. And they always come with their PowerPoint presentation, and it will be simplified because we are not expecting the parents to understand what is on there. And this is why we have to partner with the JMDA. We have a contract with them. We have right doc, and anytime we call on them, one doctor is available to us. So don't worry about that. It will be done, Coach.
Hi, good afternoon, everyone. I'm Suzette Singh Oglam from the Badminton Association and also parent to two athletes. As a parent, I'm looking at your list. I did go on the website and I looked and I'm like, oh my God, this is another language. How do I interpret what is in the list and how do I recognize these things in our everyday medications or everyday foods that we eat and so on? I don't think we are able to translate that to our everyday life, and it makes them paranoid to say, hey, I'm not having anything, I'm not going to eat this, I don't know. It's something that I think your commission should be able to take on to educate the athletes and the parents and all the different stakeholders so they are more likely to understand what it means.
And this is what I just mentioned to the other parent, the coach over there, that this is what we are going to be doing. And your suggestion is taken, but we are intending to do that. Any other question?
Yes, good afternoon, everyone. So I am a student athlete attending the JAMAICA University College, and the question I wanted to ask was, what if an athlete, what if a person, say a person feel an amount of pain and they went to the doctor and they for some pills, and say the pill enhances the person performance, but the drug is not on your list of banned substance, what will you do then?
I think when Dr. Dawson, I see you put up your hand, you want to say, she wants to answer that for me.
All right, thank you for that question. So you're saying if you get medication, all right. So that's an interesting question. So the prohibited list, the prohibited list is a very comprehensive list. Now, most drugs that would enhance performance, the World Anti-Doping has a research committee and it is in one of those categories. Now, you may be referring to a supplement. Now, in my opinion, I don't think athletes should do supplementation, because even supplements that state water compliant, we've had athletes in the past where the website of the drug said water compliant, the athlete took it and there was an adverse analytical finding. Just after that, the website took it down that it was water compliant. Remember, strict liability clause, you are responsible. So in my opinion, you should try, and so there's another course that they teach is how to enhance performance without doping, and that requires different categories, including nutrition, psychology, your entourage, who are the people around you, your coach, your psychologist, or your vibes on them, or your vibes over them, and your family. So you try to avoid supplementation, but if there is a drug that can enhance performance, it is on the list in a particular category. But remember, doping is not just enhancement. It's a risk to your health and not in keeping with the spirit of sport. You look like you're still lost. He has another question.
That's good, okay.
Anybody else?
Are you okay with that answer? Any other questions? But we must also remind you about the TUE, that you can apply for TUE, and sometimes it can be done retroactively. Because if you find out that, Mr. I'm going to call the sample collection manager to come and explain it, because it's used for persons who have a legitimate condition that can only be treated by a specific drug, and you can apply for the TUE exemption, therapeutic use exemption. It goes before a committee, not before Jadco. Jadco facilitates it. We send it to our TUE committee chairman, who is a consultant specialist in his field, and that whole committee is a committee of doctors, experienced and established doctors, who look at it and see what is the situation, and then send it back to us whether they approve it or not approve it. Go ahead.
Yes.
Thank you. I am from the J3As. I'm an educator as well.
Tell them about the process of the TUE.
Yes. So for the therapeutic use exemption, once it is that it is a medical reason, you will consult your doctor, your physician, and the form is on our website. You can download it, bring it to your physician to complete, and you will submit it to us. And that, as Mrs. Jarrett stated, will go to the committee. We'd advise, though, if you have an upcoming competition, that you do this at least 30 days in advance, because the process will take some time. And if it is that the TUE is not approved, or you haven't received any notification that it has been approved, and you go ahead and compete, and you are selected for doping, then you could return and find it. All right?
Also know that sometimes the doctors will look and see on their list, because we send a list into the doctors, and when they call us we refer them to the prohibited list. And if they notice that the drug that they must prescribe has a substance that is prohibited, they talk to us so we can do a retroactive TUE for the athlete. So yes, Miss, I recognize you, Mrs. Blackwood, board member. Can we have the mic to Mrs. Blackwood, please? Somebody.
She has a
Mrs.
question.
Blackwood, there was somebody with a mic in their hand before.
She has a question.
Coming to you. I'm sorry. Apology. Yes, Ms. Blackwood.
Okay. I have a question that at my age, I have a grandchild who is 16 years old and represents one of the top high schools in Jamaica. And after she did the first heats, she did very well, but got injured. And the doctor, who is a past student of the school, and the coaches and so on, they saw the possibility of her getting the points, going on to the finals, getting the points, and the school could become likely to be the champion school. And so they all got together and gave her an injection so that the pain would go and she could run in the finals. And she ran in the finals and broke an age group world record. And then she was tested and found that she was in violation, an anti-doping violation. And when the matter was raised, the child was penalized and given a 4-year ban. Now, what happens to the doctor and the principal and the coach, who were all complicit? She, as a teenager, was very excited about supporting her school. As a grandmother, I was even more excited about her name being in the newspaper. What I want to find out is, does the Anti-Doping Act protect my grandchild? What happened to the doctor, the principal, and the coach who colluded to give my grandchild, the injection? That happens almost every year at Champs.
Once it is brought to our attention, Miss Blackwood, there's provision for the coach and the doctor and whoever administered that, colluded with that, to be charged.